All right, welcome to our first ever virtual field trip from Northern Kentucky University's Institute for Health Innovation. My name is Carolyn No. I'm the program director there. We have a really awesome presentation for you today. I'll let our presenter introduce herself in just a minute. So I'm just going to go through some housekeeping stuff. We are asking folks to turn their mics off while the presentation is going on. You can ask questions in the chat, and we will make sure that those get to the presenter. And then at the end, if you want to raise your hand, I know there's a raise your hand feature, or if you just want to turn your mic on and ask questions, that's also totally fine. We also want to share some information about Northern Kentucky University. So I'm just dropping in a couple links. One is all about admissions to Northern Kentucky University. So if you enjoy today's presentation, you want to learn more about the opportunities at NKU, this is a really great way to find out what all of those programs look like. And then I'm also dropping in a form so that if you want to receive more information afterwards, if you're a high school senior or a junior or just want to know more, you can fill out that and they will send you information directly, which is really cool. Does anyone have any questions before we get started? Okay, I don't see any questions, but again, feel free to drop them in the group chat, and I'm going to turn it over to our presenter, Whittney Darnell.
Hi, everyone, and thank you for logging in to join us. As Carolyn said, my name is Whittney Darnell, and I come to you today from our beautiful building here at NKU, which is called Griffin Hall, which is the home of our College of Informatics. And in the College of Informatics, we do a lot of exciting different things, from cybersecurity to what I study, health communication, which is thinking about the way people seek and share and process information about their illnesses, their wellness, and how we create messages to help people live healthier lives. And sometimes it's the person themselves we have to teach how to ask for the health and wellness needs that they have. And sometimes it's a commercial or something that you see come across a billboard that you pass on the highway that we're trying to design so that people live healthier lives. So that's kind of my job, is to figure out what we need to say, how we need to say it, when we need to say it, so that people can live healthier lives.
All right. My name is Amanda Andrews. I also work with Carolyn No at the Institute for Health Innovation as their program assistant. So why HealthComm?
Good question. So one thing I would say to all of you, I know we have students here today from 6th all the way through 12th grade, is to start listening to the things that you love. Start listening to who you are, because you probably already have some things just in your gut that you know you're interested in. And for me, health was always one of those things. I enjoy learning about health. I enjoy learning about different foods, why this one was healthier than this one. I'm extremely active. I run, I do yoga, I hike, I played a lot of sports, and I like motivating people and educating people. And it was something that I just had a knack for. And so, funny story, even as like a 7th or 8th grader, I used to go to my grandmother's house after school, and I was the oldest of the grandchildren, and I would be the coach, and I would run my cousins through like boot camp drills and make them practice sports. And so already as just a 7th or 8th grader, I was practicing health communication. I of course didn't know what that meant, but it was something that I did and continued to do in different ways. When I was in college, I got a certification to be an fitness instructor, and that's how I supported myself through college. I taught a lot of exercise classes. And so then as I learned that health was more than just exercise and nutrition, but it was, teaching people about a flu shot, or teaching people about how to take their medication correctly, or teaching people about some of the different laws that we have that govern our health. Those are all forms of health communication. But I can look back and remember as a 6th and 7th and 8th grader that I always loved health. It took me a long time to figure out what that meant for me as a career, but those signs and signals were already there. So notice in yourself some of the things that you love and listen, because something's telling you in there where you should go.
So what is a health comm major? As far as undergrad, what do you do with that?
Yep. So our students prepare, as I said, we talk a lot about what makes a message, what makes it good, what makes it bad. And so a lot of our work that our students do involves working with either a hospital or maybe a nonprofit, or in some capacity working to either understand what a patient needs and to help them communicate their needs. So patient advocacy is a job that some hospitals will recruit for. And so your job when you work at the hospital, or kind of like a nurse, but not quite the nurse, is that this person talks to you about how to make your treatment plan fit into your life, or how to ask questions to your doctor that maybe you were nervous to ask when you were in there. And so our students are prepared for jobs like that. They're also oftentimes hired by corporations like Walmart or CVS to work in their benefits program and to help educate employees about different health benefits that they might need or have. There's a lot of different outlets in terms of jobs that you can go with this, but what ties them all together is that you learn how to do research, and you learn how to test messages to make sure that when you're trying to get people to change their behavior, you're saying the right thing at the right time. And that's not just as easy as putting something out there. There's actually a process that you have to go through where you have to do research and you have to get people to come in to give you their feedback, and then you change it, and then you figure out, do they like it better if an older person says this message or a younger person says this message? And we play with all those different variables to create messages that will work. So that's what our students learn to do, and then they go out and they do all kinds of really interesting jobs.
Speaking of students, what was it like for you, because you've recently graduated with your PhD, what was it like for you as an undergrad, grad, or doctoral student?
Yes, so I have been in and out of school for a long time. So when I graduated high school, I went to the University of Kentucky, and I was on a mission to graduate as fast as I could. And so I graduated with a degree in communication in 3.5 years, and then started actually working for a bank for a few years, and then stayed in the banking or financial industry for about 7 years before I came back and got my master's in communication at NKU. And when I came back to get my master's, I really fell in love with teaching. And again, remember I told you that story of when I was coaching and when I was a 7th grader, I had these opportunities to now coach students and to help them kind of tune into what their talents were and to see their own potential and then to seek their dreams. And I loved that. So shortly after I graduated with my master's degree, I started teaching part-time at NKU. And I did that for another 7 years. And decided I would go back to get my PhD so I could teach here in a more full-time capacity. And so I did. I went back. I actually commuted from Northern Kentucky to Lexington, UK, 4 days a week. I would leave at 4:30 in the morning. I'd get home around 8 or 9 at night. And I was also still working here at NKU to make sure that I could give myself a chance to go after that dream. And it was really difficult. Graduate school, or that experience of going back, I was older than most of the people in my class. I was the only one with kids at home. And some of our meetings, we hadn't had the pandemic yet, so everybody wasn't ready for Zoom meetings all the time. So sometimes I'd drive all the way to Lexington, an hour and 40 minutes for a 15-minute meeting, and then drive all the way back home. And so there were some real challenges, but that burning desire to get to where I wanted to be and to have this job and this chance to even take a few minutes today to talk to all of you, I would just, on those worst days, close my eyes and think about, but I know I can do this. And so I trudged through it, and now I'm here. I'm here in my second year as an assistant professor, and I get to do a lot of amazing things in working with all of you, and then of course working with my students to get them opportunities to be ready to live out their own dreams. And that's really fun. And that's one of the special things I'll tell you about NKU. I know Carolyn put those admission paperworks, and some of you might be a long way away from thinking about college, but it's not too early to plant that seed. I've taught at a lot of colleges, and ours is one that is very special, and that we really do try to partner with students because we want to see your dream and we want to figure out how to get you there.
Great response. So kind of transitioning into your research aspect, what research do you do and why do you find that that is important?
So the unique thing about health communication research is that we study a lot of things, and because we're trying to make people healthier, right? So sometimes we want people to stop smoking. Sometimes we want people to exercise more. So we can go just about anywhere, but we're looking at those messages and the conversations people have about their health. Some of the things that I'm working on right now that are taking a lot of my time, I've been doing some research in people that have disabilities or people that are facing mental health challenges. And oh my goodness, with the pandemic coming, that's becoming more and more relevant. This has been hard. This has been hard for all of us. And we need to pay attention to that. And people need to understand how to ask for help for themselves, but also how to ask for help for someone else that they know might be really struggling. And so one of the projects that I've been working on is, what makes it easier or harder for people to say that they need help. I did a study a few years ago where I had video cameras up on the first day of class in a variety of college classrooms. And one of the questions I wanted to know was, how do instructors, the teachers, ask students if they have any accommodation needs? And that can be for disability accommodations or any kind of learning accommodation that they might need. A big difference for persons that might need accommodations in college is that there isn't necessarily a plan in place. Parents aren't able to ask for a plan for you. That is something that a student needs to be prepared to have a conversation with their teacher about. And teachers feel really uncomfortable having that conversation because college is this new, it's this new adventure, and sometimes they don't want to tell that they might need this accommodation, or they might need to learn in a different way. And so that creates an interesting challenge. So in my study, I have these video cameras up, and what I found was nobody's talking about accommodations on the first day of class. And the first day of class is a really important day when you get to college, because they lay out the expectations and the rules. And so if we're not inviting students to talk openly to us, and students don't feel comfortable with us, then it's very often the case that the conversation never happens. And what we know happens from there is that the people that do not ask for help, they often fail out of their first semester, or their grades are lower, and their chances of actually completing the degree are significantly reduced. And so what I hope to do with that study is to shed some light on that for our instructors to be more open to inviting students to have the conversation, I say in all of my classes, if you have something you want to talk about, if you are struggling with your mental health, if you have a disability accommodation or something that you might need me to know about, let's have that conversation. We can have it privately, and let's make a plan and figure out what works, because I want you to be successful. And just by taking 2 minutes to invite my students into that conversation, I get so many more students that are willing to have the conversation with me. But I do also want people that are preparing for college to know not all of your teachers are going to ask. And it's not because they're mean, but because they don't want to hurt your feelings and they don't want to make you uncomfortable either. And so it really is a two-way street of instructors, let's get better at asking, and students coming in, let's make you comfortable with saying, you know what, here's some things that I've worked. Can we work together to do this? Because ultimately, we really are both invested in getting you to where you want to go. So that's one project that I'm kind of been working on. And then I'm also doing some work in grandparents who are raising their grandchildren and how that experience is different. And specifically, some of the healthcare challenges that arise from that. So sometimes when that is happening, there are legal things that the grandparent can't do yet, and so they can't sign off, you know, for this person to have dental work done or whatever it might be. And so that's an area of research that has not been explored a lot. And so we are very excited, my team and I are very excited to begin laying that out, because we've got to find out what the challenges are. Why can't we talk about this? What's in the way of it? And when we talk about a barrier, what's in the way of it, we're talking about, is there a law that makes it impossible to have this conversation? Is it uncomfortable because, you know, because the child or the grandparent, you know, feels like people are judging them that they're in this situation? What is it that we're not able to get people to the doctor or get people to ask the questions or to get to the resources they need because something's in the way? And so in our first study, we're going to look at what is that something that is in the way. And then from there, we figure out how do we start to remove those barriers and to get the right information to the right people so that we can improve the situation for everyone. So those are the two things that are taking a lot of my time right now, but I'm doing other things too. So we are designing a mental health postcard that some of you may get in the next few weeks with the Campbell County Drug Free Alliance, which will have a list of mental health resources. That is in place of our mental health summit this year, which we couldn't have because of COVID-19. So we have little projects like that come up as well.
All right, so we have talked about the professional side of Whittney. Let's get personal with you. What are some of your hobbies?
When I'm not in teacher scholar mode, I am a mom. I have an 8th grader, and I have twins that are in the 5th grade. And so all 3 of my kids play select soccer. So we spend a lot of time. I spend a lot of time every day, 6 days a week, typically, on my way back and forth from soccer in some way, shape, or form. The most fun day is Tuesday because all 3 kids have practice at 5 o'clock at a different field, and they only have 2 parents. So that gets dicey at times. But so that takes a lot of my time, but if I do have a few minutes to do Whittney things, as I said earlier, I love to be outside. When I get a chance to even do my work outside, I'll take my laptop and be outside. So I run. I love to go find a new place to hike. I love having a grill out in my backyard, even if it's just with my family. We go and play sand volleyball sometimes. Those are the things that, especially right now, since there hasn't been a lot of other things to do. Before this, we would go to games. We do like to travel when we get a chance. I don't know if anybody on here has ever been to Hilton Head. We typically take a Hilton Head trip every year. That's a place that we love to go together as a family. And we have a little thing when we travel to a new place. We've been to some different places lately. We always try the local food. My kids are really good about experimenting with food. So we went to Puerto Rico a few years ago. We ate things, I don't know what we ate, but they were very good. And we like to experiment with trying new things.
Okay. So do you have like anything that you would like to add on to all of your general knowledge that you've gave us about the field that you haven't touched upon? If not, we can begin opening up for questions from our audience to let them kind of poke and see if they have any ideas about what they would like to ask you.
Let me think here. There's lots of, different ways that we can talk about health communication. And so maybe I'll let them ask questions. But I think what I would like students to know about our profession is that we are not only, we're a great standalone major, and our students are getting jobs. They're getting jobs in a lot of different ways. But one of the areas that we're seeing growth is we're seeing a lot of people want to double major with us or to minor in our major. And that might not mean a lot to you that are younger yet, but what it means is no matter what profession that you choose or what major that you choose at NKU, being able to communicate your ideas and understand communication and understand that just because I say pretty words doesn't mean that the person on the other end receives them or even wants to hear from me. That's a hard pill to swallow sometimes. But becoming knowledgeable about how to get your ideas across in the best way possible is a powerful, powerful tool, no matter what field you're in. And so sometimes we're invited by the medical school to come over and talk about how do we improve our communication skills. This week, I was over at Xavier University with their healthcare administration students, teaching them how to give a presentation that makes impact, that's not just for a grade, but actually a presentation that matters, like to get an idea across. So when you get here, when you come to NKU, I highly encourage you to check out the College of Informatics and a lot of the really interesting things that we have going on in our building. There's just a lot of curious things that I couldn't even begin to give you a list of films that are being produced, of this, that, and whatever that infuses our discipline. And so, yeah, let's open it up for questions and see what you want to know.
And if you guys want, feel free to unmute your mics. You can totally ask a question, actually ask a question instead of throwing it in the chat to get that little dialogue going if you'd like.
So is it mainly communicating, or is a lot of it research, or kind of both?
That's a great question. And I would say that it's both. But when you're a major with us, you will do a lot of the researching because you can't create a good health campaign without doing the research, or it'll fail. I think last year, and I miss having all of you on campus. Last year when we did the field trip, we had the students help create a health campaign, on a topic that many of you might know about, which is concussion health, right? So one problem that we have in middle school and high school is that a lot of students are getting concussions and they're going back into the game and they're not following the concussion protocol, which can be really dangerous. And so what we did in our in-person field trip was we looked at some research of, what kind of things do coaches need to know about concussion health? What kind of things do teachers need to know about concussion health? My son actually is the perfect example. Was at recess one day and on the blacktop, and somebody had done a chalk drawing, and he slipped backwards on the chalk drawing and hit his head. And the school didn't tell us, and we didn't know about this. And then a few days later, he was, exhibiting these signs that were concussion symptoms, but I didn't know he had hit his head on the blacktop. So, I'm aggravated with him, like, why are you forgetting these things? And why are you grumpy? And lo and behold, he had a concussion. and needed to go through the concussion protocol. So teachers need to know things that are different sometimes than coaches. Kids need to know, hey, I need to look out for myself. Parents need to be educated. But when we showed students the research, what those things are different, and so the message is different. And that's kind of, and there's all kinds of different ways to do that. You can use surveys, you can use interviews, you can use focus groups, you can do experiments. And so when you're a health communication major, we teach you how to use all of those tools so that you can create messages that work. Does that answer your question?
Yeah, thank you.
Yeah. Looks like Edward has a question in there. Of the projects that someone might work on in the field, what are some of the biggest challenges they face? Oh, public opinion cooperation, yes. Breaking down medical lingo, yes. Access, yes. All of those are exactly the problems that we face. And funding too. So one of the problems that I get, and this is currently a problem with a project I'm working on, is they say, we need a new health message. And I'm like, great, let's do the research. Let's figure out what this needs to be. They're like, we don't really want that. We want the health message. Can you just write us something pretty? And I'm good with words. I can write you something pretty, but it may or may not. I have no idea if it's going to work because I'm just guessing. And so sometimes people do not understand that there are variables. Communication is a real science. It's not a fake science. There are real things that we have to try to manipulate to make the message work. And if we don't do the research, we can't give you a good message. So that is a big problem. The other big problem is that we don't always meet people where they are. So the other problem with communication is that it changes. So what a word, means to people today might change in 2 years or 3 years or 4 years. And so it's kind of exhaustive that you've got to keep up with these different terms and where people are. And people's experiences are different. So we know that there are some cultures and populations that don't like to go to the doctor. They don't like to go. And it took us a really long time to convince hospitals to take those rolling buses to those populations instead of making them come to the hospital because they weren't going to come. But if you showed up at a health fair with, free screenings and free whatever, all of a sudden you were able to take people's blood pressure and you were able to assess for different things and you were able to collect data and give them information, life-saving information they may need. But you had to put your ego and your beliefs aside and say, I'm going to accept and believe what people tell me they want and need. And if they're telling me they don't want to go talk to a doctor, then I'm not going to roll a scary doctor out in a white coat. I'm going to make this more community-based healthcare. I'm going to put it in their school, a place that they're comfortable with. And so that's part of the tricky part of communication is you've got to find out for each kind of culture, for each identity group, what works for them and be able to adapt your message to what they need. I'll tell you a really good example. I was doing a dental health study in Eastern Kentucky. And so there is part of the problem there aren't a lot of dentists. So access to dentists is limited. But what we also found when we started interviewing people from this particular region was that they also kind of liked that they had missing teeth. As strange as that sounds to maybe us, they're like, oh, when I see somebody else that has, an oral identity like I do, I know they're from Eastern Kentucky too. And there was kind of a pride in it. And that was shocking to us because we were like, we just assumed that if we gave you access to braces and dentures that you would want them, but they didn't want them. And so our question then becomes, okay, maybe you don't want new or pretty teeth, but there's other components of oral health. There's gum health. There's different things that happen in your mouth that we do want you. We don't have to fix your teeth if you don't want to, but we do want you to come to the dentist to get some of this other preventive. So we had to completely change. So those pretty pictures of everybody wants a great smile, that was not going to work there. They didn't want the great smile, but they did want to know that they didn't have diseases or bacteria in their mouth. That was something that mattered to them. And so once we figured that out, we were able to get people to come to the dentist.
Great questions. Does anybody else have questions going? Feel free to, like I said, unmute your mic or throw it up in the group chat.
What are some, I have a question for you if you don't have one, to those that are listening. What are some of the health challenges that people your age face, do you think? Hygiene, absolutely. Especially, oh my goodness, I mean, I can't tell you how many times I've told my 8th grader that he stinks. Does not seem to want to improve. I don't know what that's about. What else? Do any of you know the first and second leading causes of death for adolescents, people aged 10 to 18? Can anybody guess, or does anybody know? This is a Zoom limitation. I can't throw candy at you. Someone give me a guess. What do we think the leading cause? And don't Google it. Drugs? Nope. The correct answer. Oh, you want the question again? Yes. The question is, what do you think the first and second leading causes of death for the ages of 10 to 18 are in Kentucky? Leading cause of death for youth 10 to 18 in Kentucky. Not choking on tubular meat. That is not the right answer either.
Highly specific though. Your head's going.
The correct answers are actually some traffic accident is number 1. And number 2, very sadly and very concerning to me, is suicide in the state of Kentucky. And in fact, the Department of Education just released 2 weeks ago that the rate of suicide over the last 6 months, which correlates with our pandemic, is on pace to be far beyond even what we've experienced already. But the second leading cause of death for youth is suicide. So one of the things, the mental health summit I talked about that we keep talking about, is in building those communication skills. I feel isolated. I feel like I, should probably reach out. We need to make that absolutely 100% easy, an easy peasy conversation. And that who you want to have that conversation with can vary. It can be someone at the school. It can be another friend. It can be a parent. If you feel comfortable with a parent, it can be, but it needs to be someone, and it needs to be easy peasy. It needs to be just as easy as I stubbed my toe and I'm going to get a Band-Aid. It needs to be that easy to have a conversation to say, this pandemic is getting to me, and I just need to get out of my own head and have somebody to talk to for a little while. And I'll share with you, my 5th grader, one of my kids, more than probably the other 2, really towards the end, and I say the end because my kids are actually back in person school. Before they went back to school, I mean, he was emotional, and he's like, I don't even know why I'm sad. And we would just keep talking about it. And so now that he is back in school, it is night and day difference, because there is socialization. He's not isolated. He's not bored all day. There's a difference. And so some of those feelings are normal. They're natural. But I was proud of him that he could at least tell me that, I don't even know why I have nothing to be sad about. I know I'm safe, but I'm sad, Mom. And I was really proud that he could have that conversation. But even you being able to have that conversation is not enough. It's also important that you seek out and look at your family members and your friends, and do they seem like maybe they're struggling a little bit? And if they are, we have a little acronym called ACT, which is acknowledge, care, and tell. And in an acknowledge statement, you say, oh, I noticed, you seem a little sad, or I notice you're wearing different clothes, or I notice you're experimenting with your hair, but I've noticed that something in your behavior has changed. And that's your acknowledge statement. I'm acknowledging, and as humans, we like to be acknowledged. And then care, well, if you need anything, I care about you. I hope you know that. I care about you. And then the tell is, especially as young people yourself, you can't carry someone else's burden by yourself. So you have to tell appropriate people. And the reality is, sometimes you can't tell that person's parent, because sometimes it's that person's parent or guardian that is causing the problem for that person. But there are other people. There are hotlines that you can reach out to. There are school administrators that you can reach out to. There are people that you can reach out to. But that tell part is so important. So we know that's the second leading cause of death, and there's a chance that this year it becomes the leading cause of death, not the second, but the first. And I don't want that to happen. So all of you are old enough, 6th through 12th grade, all of you are old enough to act, to acknowledge, care, and tell. And when you do, you are actually being mini health communicators by doing that. And you're building your own health communication skills. Any other questions? Thank you, Edward. What do you guys know about NK? Anything we can talk to you about NKU? How many of you have been here? Or has anyone not been here? Might be the easier question. We can't wait till you come back. Carol and Amanda, that's probably a good question for you two.
Okay, so with our in-person field trips, what it normally does is we have tracks. So what that means is if you were going to our in-person, not only would you get to be on campus, but we would have multiple people you would be speaking with. So you may have spoken with Whittney and done like a presentation with her, but then you would have also maybe gone into our simulation center and got to work with one of our nursing staff or one of our radiology staff, and kind of got to like see what they do, either in our outpatient or inpatient simulation centers. One of our presenters, they normally do a CPR thing where it's a game you play, and in that game you're kind of racing, but you're learning how to do CPR correctly. So, deep enough compressions, the right rate and stuff, but it's got a little game on the board. So there's ambulances racing against each other. And so that's one of the things we do. Carolyn, do you want to talk about another one?
Yeah, I mean, in radiology, you get to look at some of the really cool scans that they've taken and try and clean up like a radiologist would to figure out what's going on with someone. They also talk about our partnership we did with the Cincinnati Museum Center, where we were able to scan the mummy Umi in the X-ray, and they did a CT, and all the really interesting things that they learned about Umi. And I'm not going to spoil that too much because I think one of them, the folks who worked on it, might do another presentation that you all are signed up for. That was just a really cool project. And personally, as a museum studies person, it was like very exciting for me to see the stuff that we would read in books like actually come to life, and all the really interesting information you can learn about something that happened thousands of years ago. Very exciting. And then afterwards, you get to go on a tour of campus, which is really exciting too.
So we have a few different simulation centers. So we have our radiology simulation. So pretty much when you get into it, you would be walking into, it looks like an actual radiology department. When you walk in, you have the computer screen set up, and then you also have another room that has the actual equipment so you could lay a patient down. And all of these simulation centers, they're set up to be as realistic as possible with the hospitals to better train our students how to actually go out and be able to use these techniques. So instead of just reading about it or watching a video, they actually get to take the equipment and run through it. And all of the equipment works. It's not, you know, just a box that you like act like you're doing something. It actually will do x-rays. We have an inpatient and outpatient center for our nursing students. Our really cool mannequins, which they breathe, they speak, you can insert IV fluids into them, and the one that everybody really loves actually can give birth to a baby. And yeah. And when I say give birth, it does give birth. There are fluids that they put inside, and it comes out when the water breaks. And there is a mock placenta and all kinds of other stuff that comes with that. So our nursing students actually get to work with those mannequins and learn. So I definitely think that, you know, when everything opens back up, that these virtual field trips are really amazing to get you ready for our in-person field trips. So, and then Carolyn also shared some a panoramic of our simulation centers so you can get a visual of what I'm saying. Do you have anything else to add about the simulation centers, Carolyn?
No, I mean, that's a really good description. I'm trying to think of anything else that we do in our simulation centers for field trips. Like we've done like head wraps and stuff too, so you get to learn about wound care.
I don't think we've ever actually incorporated it, but one of the things they do, they have actors, students from the SOTA department come in to do clinic visits. So the students will come in and they'll be given a script, and it'll be a kind of mock illness. And then our nursing students will come in and they won't know the illness, but they will evaluate the patient, go through like they're supposed to, and then come out and go through all the steps and do their diagnosis. And then after that, they will go into a observation room and kind of talk with their professors about what they thought. Their professors will give them feedback and, you know, this is what you could have done, or this is what, you know, you did really great at, and stuff like that. So it's really, our simulation centers are really awesome because they're a great learning environment, and they really kind of promote a realism to learning about the health industry. So if that is something you're interested in, I definitely say look into our College of Health and Human Services. Great programs.
And many of our programs on campus actually use the simulation center that you wouldn't think. I think the business school has even used the space for programs. Our social work, counseling, you know, it's not just a space for health, what you would consider like typical health professions. It's a space for anyone on campus who wants to use it.
I always forget about our social work department.
So you should totally come as soon as we're allowed to have you.
Yes. Yes.
Any other questions? We have 10 minutes left. Well, if there are no other questions, you are going to receive an evaluation. So you can give us your feedback on the event. Since this is our first ever, we really want to know what you thought. Students, you're going to get one for yourself, and then teachers / parents, you'll get a different one, just asking pretty similar questions, but different perspectives. And we would really appreciate it if you fill it out so that we can make the next of these even better.
Yeah, I will be sending those out to the teachers. It'll be through a Qualtrics link. So the teachers will get the teacher evaluation, and then I will also include the link for the students that they can send out to their students, because I am not for sure exactly who you all are, what your names are, and I don't believe I have the students' email addresses. So I'll be relying on the teachers kind of to get those out and to get them back to us. So, but it would be much appreciated because we'll be able to use those in multiple ways.
All right. Well, thank you to Whitney for spending some time with us today and sharing all about her career.
Thank you, everyone. I really enjoyed being part of this.
All right. And I believe most of you are signed up for our next few. Amanda, do you want to preview what our next the next week will be hot topic? So
yeah, so our next is a hot topic, and Whitney will be back with her fellow faculty member, Zach Hart. They'll be talking about their research that they've done with disability and accommodation and younger. And Zach, part of the motivation for him was that his son is disabled. So we get to get a personal kind of touch to the research and also get our beautiful Whitney to come back and talk about her motivation for the side of the research. So that's next Friday. And then on September 18th, as Carolyn mentioned, we will be having one of the teachers from the radiology department. His name is Jason Applegate. He will be joining us to talk about his transition from studenthood into faculty, and also about some of the projects he's worked on, from scanning UMI to doing 3D printing. So that'll be really interesting, and I think you guys will really enjoy it as well. So thank you guys so much for coming.
Thanks, everyone.
Have a great day.